Question 1. Which of the following is the most critical step in the decontamination process? A. Rinsing instruments. B. Manual cleaning. C. Instrument transportation. D. Sorting instruments. Answer: B. Manual cleaning. The concept tested here is the importance of manual cleaning within the decontamination process. While all steps are crucial, the keyword most critical highlights that thorough manual cleaning, also known as cleaning at the point of use or preliminary cleaning, is essential to remove gross soil and bioburden before further processing. This step significantly impacts the effectiveness of subsequent mechanical cleaning and sterilization by preventing the drying of blood and tissue onto instrument surfaces. For example, if instruments are not properly cleaned by hand initially, residual soil can prevent sterilization from being effective. Always remember that if an instrument is not clean, it cannot be sterile. Question 2. What is the primary purpose of a washer disinfector in the sterile processing department? A. To sterilize instruments. B. To lubricate instruments. C. To clean and thermally disinfect instruments. D. To pack instruments for sterilization. Answer: C. To clean and thermally disinfect instruments. This question focuses on understanding the function of a washer disinfector. The keyword primary purpose directs you to its main role, which is not sterilization but rather a thorough cleaning and thermal disinfection of instruments after manual cleaning. These machines use various cycles involving detergents, rinsing, and high temperatures to reduce microbial contamination to a safe level, making the instruments safe for handling and further processing. For example, after being run through a washer disinfector, instruments are significantly cleaner and safer to handle as technicians prepare them for sterilization. Keep in mind that disinfection is a reduction in microorganisms, not a complete elimination like sterilization. Question 3. What type of water should be used for the final rinse in a manual cleaning process? A. Tap water. B. Distilled water. C. Deionized or reverse osmosis, RO, water. D. Chlorinated water. Answer: C. Deionized or reverse osmosis, RO, water. The concept tested is the importance of water quality in the final rinse of instrument cleaning. Using deionized or reverse osmosis, RO, water for the final rinse is crucial because it helps prevent the formation of mineral deposits and stains on instruments that can be caused by impurities in tap water. These impurities can hinder the sterilization process or even damage the instruments over time. For example, using regular tap water might leave behind water spots or mineral residue that could interfere with the steam during sterilization. Always remember to use high-quality water for the final rinse to ensure instruments are truly clean and ready for sterilization. Question 4. Personal protective equipment, PPE, worn in the decontamination area includes: A. Surgical mask, sterile gown, and shoe covers. B. N95 respirator, hairnet, and clean scrubs. C. Impermeable gown, face shield, gloves, and fluid-resistant shoe covers. D. Lab coat, safety glasses, and latex gloves. Answer: C. Impermeable gown, face shield, gloves, and fluid-resistant shoe covers. This question assesses knowledge of appropriate personal protective equipment, PPE, for the decontamination area. The crucial aspect here is decontamination area, which is where instruments are soiled and biohazards are present, requiring maximum protection. An impermeable gown, face shield, gloves, and fluid-resistant shoe covers are essential to protect technicians from splashes, sprays, and infectious materials. For instance, if a technician is manually cleaning instruments, splashes of blood or bodily fluids are common, and proper PPE acts as a barrier. Always prioritize wearing the correct PPE in decontamination to ensure your safety from potential hazards. Question 5. What is the purpose of enzymatic detergents in instrument cleaning? A. To sterilize instruments. B. To break down proteins, fats, and carbohydrates. C. To lubricate instruments. D. To harden instrument surfaces. Answer: B. To break down proteins, fats, and carbohydrates. This question tests the understanding of how enzymatic detergents function in instrument cleaning. The key here is enzymatic detergents, which specifically means they contain enzymes designed to break down organic matter such as blood, tissue, and other bodily fluids. These enzymes, like proteases, lipases, and amylases, work by digesting the soil, making it easier to remove from instrument surfaces during the cleaning process. For example, an enzymatic cleaner will help dissolve dried blood on a surgical instrument, making it easier to rinse away. Remember that enzymatic detergents are cleaning agents, not disinfectants or sterilants. Question 6. The Bowie-Dick test is performed to detect A. Air leaks or inadequate air removal in a dynamic air removal steam sterilizer. B. Sterilant concentration in an EDO sterilizer. C. Biological kill in a hydrogen peroxide sterilizer. D. The presence of residual moisture after sterilization. Answer: A. Air leaks or inadequate air removal in a dynamic air removal steam sterilizer. This question assesses knowledge about the specific purpose of the Bowie-Dick test. The keyword Bowie-Dick test is a strong indicator, as this test is exclusively used for dynamic air removal, pre-vacuum, steam sterilizers to ensure proper air evacuation from the chamber. It detects inadequate air removal, which could lead to sterilization failures. For instance, if air remains in the chamber, steam cannot properly penetrate instrument packs, leading to non-sterile items. This test is crucial for daily sterilizer performance monitoring and is typically performed before the first process load of the day. Question 7. What type of packaging material is typically used for items that will be sterilized by hydrogen peroxide gas plasma? A. Textile wraps. B. Paper/plastic peel pouches. C. Cellulose-based materials. D. Non-cellulose materials, e.g., Tyvek or specific synthetic wraps. Answer: D. Non-cellulose materials, e.g., Tyvek or specific synthetic wraps. This question focuses on appropriate packaging materials for specific sterilization methods. The keyword hydrogen peroxide gas plasma is crucial because this sterilization method is incompatible with cellulose-based materials, as they absorb the sterilant and can interfere with the process. Therefore, non-cellulose materials like Tyvek, polypropylene wraps, or specific synthetic peel pouches are required to allow the sterilant to penetrate while maintaining sterility. For example, surgical instruments sterilized with hydrogen peroxide gas plasma must be packaged in special pouches or wraps designed for this specific sterilant. Always remember to match the packaging material to the sterilization method for effective results. Question 8. What is the acceptable temperature range for the decontamination area? A. 60 degrees Fahrenheit to 65 degrees Fahrenheit, 16 degrees Celsius to 18 degrees Celsius. B. 68 degrees Fahrenheit to 73 degrees Fahrenheit, 20 degrees Celsius to 23 degrees Celsius. C. 70 degrees Fahrenheit to 75 degrees Fahrenheit, 21 degrees Celsius to 24 degrees Celsius. D. 75 degrees Fahrenheit to 80 degrees Fahrenheit, 24 degrees Celsius to 27 degrees Celsius. Answer: A. 60 degrees Fahrenheit to 65 degrees Fahrenheit, 16 degrees Celsius to 18 degrees Celsius. This question tests knowledge of environmental controls in the decontamination area. The acceptable temperature range is critical for ensuring technician comfort and safety, as well as controlling microbial growth in a biohazardous environment. Keeping the decontamination area cooler helps to prevent bacterial growth and makes the working conditions more tolerable for staff who are often wearing extensive PPE. For example, if the area is too warm, technicians can become fatigued and dehydrated quickly. Understanding these environmental parameters is essential for maintaining a safe and efficient sterile processing department. Question 9. Before sterilization, all hinged instruments should be A. Oiled and closed. B. Disassembled and closed. C. Oiled and opened. D. Disassembled and opened. Answer: D. Disassembled and opened. This question addresses the proper preparation of hinged instruments for sterilization. The key concept is ensuring maximum exposure of all surfaces to the sterilant, which is why instruments should be disassembled and opened prior to packaging. Disassembling allows for cleaning and sterilant penetration to internal surfaces, while opening hinged instruments, like scissors or forceps, prevents cold spots or areas where the sterilant cannot reach effectively. For instance, if a pair of clamps is sterilized in the closed position, the sterilant may not reach the internal box lock, potentially leading to a non-sterile instrument. Always remember that proper presentation is vital for effective sterilization. Question 10. What is the maximum recommended weight for a wrapped linen pack to be sterilized in a steam sterilizer? A. 8 pounds. B. 10 pounds. C. 12 pounds. D. 16 pounds. Answer: C. 12 pounds. This question assesses knowledge of specific guidelines for steam sterilization of linen packs. The maximum recommended weight of 12 pounds is a crucial parameter to ensure proper steam penetration and drying during the sterilization process. Overweight packs can lead to incomplete sterilization or wet packs, compromising sterility. For example, a linen pack weighing more than 12 pounds might not allow steam to reach the center effectively, resulting in a failed sterilization cycle. Adhering to weight limits helps guarantee that all contents of the pack are adequately sterilized and dried. Question 11. How often should biological indicators, BICE, be performed for steam sterilizers? A. Weekly. B. Monthly. C. Daily, and with every load containing an implant. D. Annually. Answer: C. Daily, and with every load containing an implant. This question tests the frequency of biological indicator, BI, testing for steam sterilizers. Performing BICE daily, and with every load containing an implant is the standard practice because they directly verify the sterilizer's ability to kill highly resistant bacterial spores, providing the highest level of assurance of sterility. Implants are critical items, so an extra layer of assurance is required for those loads. For example, if a BI shows growth, it indicates a sterilizer malfunction, and all items processed since the last negative BI must be recalled. Regularly monitoring with BICE is a fundamental component of a robust quality assurance program. Question 12. Which of the following is an example of a chemical indicator, CI, Class 5, integrating indicator? A. Tape placed on the outside of a package. B. A strip placed inside a package that changes color based on temperature and time. C. A strip that only reacts to steam at a specific temperature. D. A test used to check air removal in a pre-vacuum sterilizer. Answer: B. A strip placed inside a package that changes color based on temperature and time. This question asks about the characteristics of a Class 5 chemical indicator. A Class 5 integrating indicator is designed to react to all critical parameters of a sterilization cycle, time, temperature, and presence of sterilant, and is placed inside each package or tray to confirm sterilant penetration. Unlike external indicators or Boedic tests, they provide a more comprehensive assessment of sterilization conditions within the pack. For example, If the Class 5 indicator changes color as expected, it helps confirm that the steam reached the inside of the package and was present for the correct duration and temperature. These indicators give a good indication that the sterilization process was effective. Question 13. What is the term for the process of wiping or spraying soiled instruments at the point of use? A. Disinfection. B. Decontamination. C. Gross soil removal. D. Sterilization. Answer: C. Gross soil removal. This question focuses on the initial steps taken with instruments immediately after use. The phrase wiping or spraying soiled instruments at the point of use specifically refers to gross soil removal, which is the preliminary removal of visible debris like blood and tissue. This vital step prevents soil from drying onto the instruments, making subsequent cleaning more effective and reducing bioburden during transport. For example, a surgical nurse might wipe instruments with a damp sponge during a procedure to prevent blood from hardening. This initial step is critical to facilitating the entire decontamination process. Question 14. How should delicate instruments, such as those used in ophthalmology, be cleaned? A. In an ultrasonic cleaner with other heavy instruments. B. Manually, using soft brushes and gentle detergents. C. In a washer disinfector on a high-impact cycle. D. By soaking them in a strong disinfectant for several hours. Answer: B. Manually, using soft brushes and gentle detergents. This question addresses the proper cleaning of delicate instruments. These instruments require special care to prevent damage, making manual cleaning, using soft brushes and gentle detergents, the appropriate method. Placing them with heavy instruments or using aggressive mechanical cleaning cycles can cause bending, scratching, or misalignment. For instance, tiny eye scissors or microforceps can be easily damaged if mishandled, so gentle hand cleaning ensures their longevity and functionality. Always remember that specialized instruments require specialized handling to maintain their integrity. Question 15. The purpose of instrument lubrication is to: A. Disinfect the instrument. B. Prevent rusting and restore articulation. C. Make the instrument shine. D. Mark the instrument for identification. Answer: B. Prevent rusting and restore articulation. This question tests the purpose of instrument lubrication. Prevent rusting and restore articulation accurately describes the key functions of instrument lubricant, which is a water-soluble, non-silicone-based solution applied after cleaning and before sterilization. Lubrication helps keep hinged instruments moving smoothly and prevents corrosion that could impair their function or lead to early replacement. For example, if surgical scissors are not lubricated, their hinges can stiffen and become difficult to open and close, making them unusable during a procedure. Proper lubrication is a critical step in maintaining instrument integrity and prolonging their lifespan. Question 16. What is the main risk associated with wet packs after steam sterilization? A. They are too hot to handle. B. They are considered contaminated. C. They will rust quickly. D. They are difficult to store. Answer: B. They are considered contaminated. This question focuses on the crucial issue of wet packs following steam sterilization. The main risk, indicated by the term main risk, is that they are considered contaminated because moisture can act as a wicking pathway for microorganisms from the outside environment to penetrate the sterile barrier. Even a small amount of moisture can compromise the sterility of the contents, making them unsafe for patient use. For example, if a wrap tray comes out of the sterilizer with visible moisture, it must be reprocessed because its sterility cannot be guaranteed. Always remember that wet equals contaminated in sterile processing. Question 17. Which sterilization method uses ethylene oxide, EDO, gas? A. High-temperature steam. B. low-temperature gas plasma. C. Low-temperature gas. D. Peracetic acid immersion. Answer: C. Low-temperature gas. This question identifies a specific sterilization method. Ethylene oxide, ETO, gas is a form of low-temperature gas sterilization used for heat and moisture-sensitive items that cannot withstand the high temperatures of steam sterilization. ETO is a powerful sterilant that kills microorganisms but requires a long aeration time to dissipate toxic residuals. For example, certain complex instruments or delicate devices with lumens might be sterilized using ETO because they would be damaged by steam. Understand that ETO is effective but requires careful handling due to its toxicity and aeration requirements. Question 18. What is the minimum frequency for checking the functionality of an ultrasonic cleaner? A. Annually. B. Monthly. C. Weekly. D. Daily or each shift. Answer: D. Daily or each shift. This question addresses the required monitoring frequency for an ultrasonic cleaner. Checking its functionality daily or each shift is essential to ensure that the cavitation, the microscopic bubbles that clean instruments, is occurring effectively. This is typically done using a foil test or a specific protein residue test. For example, if an ultrasonic cleaner isn't functioning properly, instruments processed through it won't be adequately cleaned, leading to potential sterilization failures. Regular performance checks ensure the equipment is consistently providing the necessary cleaning action. Question 19. The process of arranging instruments in a tray for sterilization is called A. Kitting. B. Sterilizing. C. Assembly. D. Decontaminating. Answer: C. Assembly. This question defines a key step in the sterile processing workflow. The act of arranging instruments in a tray for sterilization is known as assembly, which involves inspecting, testing, and organizing instruments into sets according to count sheets or recipes. This careful arrangement ensures that instruments are correctly identified, in good working order, and presented properly for effective sterilization. For example, during assembly, a technician confirms all instruments are present, functional, and correctly positioned in the tray before it is wrapped. Accuracy during assembly is crucial for patient safety and surgical efficiency. Question 20. What is the primary reason for placing a chemical indicator inside every package/tray that will be sterilized? A. To prove that the item is sterile. B. To verify the presence of the sterilant inside the package. C. To check the sterilizer's performance. D. To determine if the package has expired. Answer: B. To verify the presence of the sterilant inside the package. This question asks about the specific purpose of internal chemical indicators. The primary reason for placing a chemical indicator inside every package or tray is to verify the presence of the sterilant inside the package, ensuring it has penetrated the packaging material and reached the instruments. While external indicators confirm exposure to the sterilant, internal indicators confirm conditions within the actual package. For example, a color change on an internal indicator confirms that the steam or other sterilant successfully reached the instruments within that specific pack. Internal indicators are crucial for confirming sterilant penetration for each individual item. Question 21. What information must be included on the label of a sterilized package? A. The technician's name and shift. B. The expiration date and contents. C. The date of sterilization, sterilizer number, and load number. D. The patient's name and procedure type. Answer: C. The date of sterilization, sterilizer number, and load number. This question addresses essential labeling requirements for sterilized packages. Including the date of sterilization, sterilizer number, and load number is crucial for proper tracking and recall purposes. This information links the sterilized item to a specific sterilization cycle, allowing for quick identification and retrieval if a recall becomes necessary due to a sterilizer malfunction or positive biological indicator. For example, if a biological indicator from a specific load turns positive, these label details allow staff to quickly identify and retrieve all items from that compromised load. Accurate labeling is fundamental for maintaining accountability and patient safety. Question 22. Which of the following defines event-related sterility? A. Items remain sterile indefinitely unless the package is opened. B. Items are considered sterile for a set duration, regardless of handling. C. Sterility is maintained until an event occurs that compromises the package. D. Items are re-sterilized after every use, regardless of package integrity. Answer: C. Sterility is maintained until an event occurs that compromises the package. This question clarifies the concept of event-related sterility. This principle states that items remain sterile unless an event occurs that compromises the integrity of the package, such as being dropped, torn, or wet. It emphasizes that sterility is not time-limited but rather dependent on the continued integrity of the sterile barrier. For example, if a package is found to have a tear, it is considered non-sterile, even if it hasn't reached an arbitrary expiration date. This approach prioritizes package integrity as the determinant of sterility. Question 23. What is the first step when a surgical instrument is received in the decontamination area? A. Place it directly into the ultrasonic cleaner. B. Inspect it for damage. C. Sort it by type and material. D. Submerge it in an enzymatic solution. Answer: C. Sort it by type and material. This question tests the initial actions upon receiving soiled instruments in decontamination. The first critical step is to sort it by type and material. This sorting is essential because different instruments, e.g., rigid, flexible, lumened, delicate, and materials, e.g., stainless steel, aluminum, require specific cleaning methods and chemistries to prevent damage and ensure effective cleaning. For example, separating microsurgical instruments from heavy orthopedic instruments prevents damage during the cleaning process. Proper sorting at the beginning of the decontamination process optimizes cleaning efficacy and protects valuable instrumentation. Question 24. A sterilization load record should include all of the following except: A. The results of the biological indicator, BI. B. The type of sterilizer and cycle used. C. The name of the surgeon who will use the items. D. The total number of items in the load. Answer: C. The name of the surgeon who will use the items. This question focuses on the essential components of a sterilization load record. While the results of the biological indicator, type of sterilizer and cycle used, and total number of items in the load are critical for traceability, quality assurance, and recall purposes, the name of the surgeon who will use the items is not a standard requirement for a sterilization load record. Load records are about the sterilization process itself, not individual patient or surgeon assignments. For example, you would record the date and time of the cycle, but not the specific doctor planning to use the instruments. Focus on the data necessary to verify sterilization efficacy and track the instruments internally. Question 25. What is the term for the process of physical removal of all visible soil and organic material from an item? A. Disinfection. B. Sterilization. C. Cleaning. D. Antisepsis. Answer: C. Cleaning. This question defines a fundamental concept in sterile processing. The physical removal of all visible soil and organic material from an item is the definition of cleaning. This step is absolutely essential because it reduces the bioburden and prepares instruments for effective disinfection or sterilization. Without proper cleaning, disinfection and sterilization processes cannot achieve their intended results, as organic matter can shield microorganisms. For example, if a surgical instrument still has visible blood on it, it cannot be reliably sterilized, no matter the method. Remember, cleaning is always the first and most crucial step in making an item safe for patient use.